this video, we're going to look at the metabolic acidosis, and we are looking at the causes. So to begin with some questions, the first question is, in case of the diabetic ketoacidosis. So in such a case, what is the anion gap? What is the anion gap? The second question is, in case of the Addison's disease, what is the anion gap? So in this video, we'll find out these answers and learn in detail. So to begin with, the high anion gap metabolic acidosis. The high anion gap metabolic acidosis. So under this, firstly, there is the methanol. The examples, it includes methanol. Then it also includes the uremia. So under uremia, there is renal failure. So this is nothing but the acute or the chronic. After this, there is also the diabetic ketoacidosis. Next is paraldehyde. Then comes the iron tablets, INH, then lactic acidosis, as well as the ethylene glycol and the salicylates. So all this comes under the high anion gap metabolic acidosis. Now we'll look at the normal anion gap metabolic acidosis. So under the normal anion gap metabolic acidosis, it contains the fistula, pancreatic, then the sigmoidostomy, then comes the small bowel fistula, then the extra chloride, that is the hyperalimentation, then comes the diarrhea, then the carbonic anhydrase inhibitors, that is the acetazolamide, next the Addison's disease, as well as the RTA, that is the renal tubular acidosis. Now to answer our questions, the first question we asked was, what is the diabetic ketoacidosis? So the diabetic ketoacidosis, it comes under the high anion gap acidosis. It comes under the high anion gap acidosis. The second question was, what about Addison's disease? Addison's disease, it comes under the normal anion gap metabolic acidosis.